Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, we talk about the health and well-being of migrant children in the United States. Dr. Kiara Alvarez, a psychologist, and Dr. Sarah Polk, a pediatrician, talked to Stephanie Desmon about how steps can be taken to improve conditions for new arrivals and the barriers that are standing in the way. Let's listen.
Sarah Polk and Kiara Alvarez, thanks so much for joining me.
Thank you for having us.
Thank you, Stephanie.
So, Kiara, I'd like to start with you. You are a psychologist. We're talking about migrant children today, migrants who've come to Baltimore, who've come to the United States, and their health and well-being. Could you sort of set the scene for me where we are?
Certainly. Well, here in Baltimore, this has been, top of mind recently, in particular because of recent data that has been released showing that Maryland is the state with the highest numbers per capita of unaccompanied migrant children, meaning children that arrive in the U.S. without a primary caregiver or parent on their journey. And as well as the Key Bridge collapse here in Baltimore has really highlighted the important and often unseen contributions of immigrants to the local community and to the national economy. So there's a lot of reasons why we're thinking about it right now, but the reality is that we've had, migrant children, particularly from Latin America, in increasing numbers in Baltimore for over a decade. And so we've really been discussing the need for a more comprehensive support and response for these children and their families.
Sarah, how do they get here? I mean, Baltimore is not exactly a border state. How come we're getting so many migrants in Maryland?
I don't think we entirely know the answer to that question, but there are a few important factors. One factor is that Baltimore in particular is located along the I-95 corridor, so there's ease of access and we're close to large transportation hubs. In terms of arriving to Maryland and then choosing Baltimore has a lower cost of living than the suburbs around Washington, D.C. Another issue on which I would not entirely hang my hat, but another issue is that Baltimore and Maryland have relatively stable economies without quite so much the boom and bust. So there's potentially slightly more reliable jobs for immigrant adults. So in terms of the ability to survive in an underground economy. And then it should not be understated that Baltimore and Maryland have been welcoming of immigrants. It is widely recognized how important they are to our communities and to our economies. And so people do feel welcome in this state when that might not be the case in other places.
Sarah, what's their health like when they arrive?
I'm a general pediatrician, so I spend most of my time thinking about 0 to 22-year-olds, although the health and well-being of their parents is critically important to the children themselves. Children themselves, thankfully, are largely healthy. So in general, I take care of a lot of healthy kids, physically healthy children, but who are living in high-risk environments and are living in families that have experienced very significant difficulties, sometimes in the past and sometimes ongoing. We're increasingly aware of the impact of social determinants of health on health throughout the life course. And so a lot of what I spend time thinking about with children and families is somewhat less their physical health in this moment than in supporting their emotional and mental health in the long term in the context of a history of trauma, a history of exposure to trauma, ongoing poverty, discrimination, and racism.
Kiara, I'm going to ask you the same question, but I'm going to ask you how their mental health is when they arrive.
Yeah, so I think that, overall, when we look at children, including children that have experienced, high rates of potentially traumatic events, we still see sort of a remarkable ability of children to cope and to continue on, with their daily lives in the face of that. And in the past, we really called that resilience. And I think we've really started to move away from that notion because it sort of implies that, children should just sort of pick up and keep moving and do well in the face of conditions that they should not have to experience. So what we see, migrant children arrive in the U.S. in different ways, and those that arrive without family members on their journey, often have been exposed to quite a lot of potentially traumatic events, both prior to the journey, because there was some sort of condition, whether it was violence in their immediate environment or, adverse conditions there that prompted the need to make the journey. There's likely been separation from a primary caregiver, for some extended period of time, as well as the journey itself, is quite traumatic. And the way that the conditions have been set up at the border, particularly in the past 10 years or so, are just really increasingly making it more and more difficult and challenging. And so the kinds of things that children get exposed to at a very early age, are things that we would not expect or want, for any child to have to experience, in addition to then the challenges with being able to settle peacefully in the United States, be able to be integrated into a school community in an inclusive way, and all of those factors. So we do, have concern for the impact of trauma, not only in the immediate, but in the long term. We know now much more about how that can lead to chronic health conditions over time and things like that. But what we really want to emphasize, I think, in the moment is the importance of how inclusive environments, supportive environments, environments that give children access to education, to supportive peer groups, and to supportive adults can really buffer those negative effects for them. And that ultimately, when we talk to families, that's really what they want for their kids as well, for them to be able to be safe, to be healthy, and to be supported.
Sarah, what should we be doing for these kids that we're not doing?
I think an important and achievable goal is to find ways to more quickly enroll immigrant children into public schools. Kiara was speaking about inclusive and supportive environments, and children who arrive here unaccompanied need to participate in a stable environment and need to re-enter an educational system. And some of them, may have had interruptions in their education before. But again, as Kiara was saying, to start building a stable environment. Immigrant children are eligible for a public education, so we don't have to create a right or their right to participate, but we have to facilitate their entry. And as a pediatrician, we think a lot about that because some of that is just about getting kids required vaccines and getting them the paperwork they need to say they're healthy and don't need special accommodations in schools.
So how can we do that better?
So through partnerships. I think the good news is that what we're talking about is actually a fairly low budget intervention, but it will take a number of partners. So there need to be pediatric providers who can do health exams and attest that kids don't need special accommodations in schools. We need health departments to provide needed vaccines. We need school representatives who can orient families to where's your local school. This is how you prove where you live in order for your child to attend. And we need health systems to provide a small number of appointments for kids who are recognized to have significant health needs that need immediate ongoing care in a medical home. We want that for all kids, but in the immediate term, we need those for the kids who are at high risk of an adverse event in the short term.
And Kiara, how do we handle that? I know there's a shortage of mental health care generally. How do we make sure that these children who need it are included in that?
Absolutely. There definitely is a shortage of mental health care, and there always has been a shortage of mental health care, in languages other than English, although we certainly can be doing a lot more by investing in that workforce, because there's a lot of people that do want to go into mental health professions and want to be able to provide that specialized support. And just financially, it's quite an investment for many people to get a master's in social work or counseling, for example. We could be making that much more accessible for people who have those language skills. And we could also be paying people much better, both in our health systems and in our school systems, to provide mental health care, to eliminate some of those barriers to practice. And so we do need to continue to shore up our mental health workforce and provide the specialized services that children need. But we also can be investing in those programs that serve, in their own way, a therapeutic role, being able to participate in sports, being able to participate in arts enrichment, all of those kinds of activities that are beneficial for kids, but that are often available to folks that can pay for them or that can afford the transportation or the access to particular services. There's still a long way to go to make those kinds of things both more readily available for kids so that they have access to those kinds of programs that really support their well-being, as well as to provide training for all of those that are in contact with kids, whether that's in schools or recreational settings, on mental health support and on what they can do to recognize mental health concerns and just to provide that baseline level of public mental health support and infrastructure for those that need more specialized care.
And Sarah, you've researched language barriers. Could you talk about what the barriers are and sort of, I know we probably don't even think about the kind of barriers that are in place.
Yes. So anyone who provides care with any federal funding, so any facility or provider that provides care to patients insured through Medicaid, regardless of how that individual's care is going to get paid for, anybody that accepts payment in Medicaid or Medicare from anybody has to provide language access. And language access is the notion that those with non-English language preference have reasonable access to the same services as English-speaking individuals. That right comes out of the Civil Rights Acts of the 60s and is well documented. But what we find is that particularly in mental health care, those with non-English language preference are fairly routinely denied care on the basis of language. And so we have to continue to advocate for language access in all healthcare settings.
Kiara, how do we fix this?
Well, I think one of the points that I think both of us, can hold is that there are some really amazing organizations and systems and structures already in place in the U.S. supporting migrant children and families. And at the same time, those are typically underfunded. They're under quite a lot of strain. They're often responding to emergencies, whether that be emergencies created by a new change, in the law or policy that they immediately have to respond to and change resources to answer questions about, or at times emergencies due to devastating events that happen in one part of the country and impact on migrants all over. And so we really see organizations working at a high level, sort of beyond capacity and in an emergency response capacity. And the same is true often in school districts where we have newcomer offices, but they're really strained with just the process of getting kids enrolled into schools. And so if we can really harness those particular strengths, really look at who already knows, who's already embedded in communities and understanding of the particular needs of those communities, and then direct resources, that way a combination of state level funding, county level funding, and private partnerships for those needs, then we really have a potential to make a change. And the other piece would be, I think that, there are several states, I think about 11 or 12, that have really changed their policies to be able to extend healthcare to migrant children, regardless of any, particular condition, so that all children are insured and have access to care, including mental health care. And so that would be another important model to look at and to really aim to emphasize in states where it's being considered and close to passing.
Regardless of your politics, these are children who have come here and they have needs that rival any of the needs that we have in our current population. Is there any softening of policies to sort of make it easier for children, Sarah?
I do think we're fortunate to live and work in Baltimore and in Maryland. So there's a generally welcoming environment, but I think we need to continue to advocate for an expansion of Medicaid for all children and to just acknowledge that there will be some short-term cost that has immediate benefit for children and families and long-term economic benefits for the states in terms of, raising children who are healthy to be thriving adults. It is a little bit tricky to mix health and well-being and money. But I do think it bears saying that that should not be the justification for expanding Medicaid. But the state comptroller recently issued an excellent report on the economic impact of immigrants in Maryland. And immigrants, through paying taxes, are subsidizing our healthcare systems. And immigrants are coming into cities that are losing population. Maryland would have actually lost population. The whole state would have lost population if not for immigrants. So really, they've paid for these services that now we should allow them to receive. And that's not even getting into, the other much more important and intangible benefits of diverse and healthy communities.
Sarah Polk and Kiara Alvarez, thank you so much for joining me.
Thank you so much.
Thank you for having us.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.